I'm mad as hell because we have too many elected officials in Congress who would rather let people die when they don't have to die rather than with one campaign dollar.
I'm mad because we paid hundreds of billions, no, several $1 trillion to Wall Street gamblers, to banks and insurance sharks, and there's no scarcity of money there. But when it comes to people's health insurance, which is a human right, we try to count pennies.
I'm mad as hell because we're putting profits before people. This is the United States of America. Let's get some morality.
I'm mad as hell at Democrats thinking that this public option is the same thing as single payer, and it's not.
I'm mad as hell because insurance won't pay for prevention and testing.
I'm mad as hell because I'm a school teacher. I've been a school teacher for 30 years, and I cannot understand why people, the general public, believes Fox and talk radio and doesn't question and look for the facts.
I know that people are still kind of filtering in. Since we're going to have our doctors sitting front and center, we've got a quick little bit.
And I just wanted to introduce to you the doctors. They are here all the way from Portland, Oregon. They left on the 8th of September. They've had about 6 stops since then, and they're on their way to Washington, D.C. to make a statement about healthcare reform. Try to talk to Obama when they get there. So.
These are real doctors who've taken time away from their private practices to be here, and because they care that much, they've taken off across the country in an RV so that they can educate Americans, so that we can make the right choice, the fair choice, the educated choice about single payer. So why don't we all stand up for a minute? Because I'm mad as hell, and I'm not going to take it anymore. And I think that sums up how we all feel about the debate, the healthcare debate that we're having in this country, okay? So I'll count you in, and we'll all do it, okay? You ready? 1, 2, 3. On that. Okay, so it's Chuck Grassley, everybody. I want you to see his face in front of you right now, okay? And I want you to say it so loud that wherever he is, he hears it, okay? Let's do it just like before on 3. 1, 2, 3.
We're a group of Oregon doctors joined by colleagues across the nation. We're angry that anyone in the richest nation in the world lacks access to health care.
I'm mad as hell for a lot of reasons, but particularly I'm mad as hell about the fact that the SWIFT voters are back.
16,000 doctors who are active in favor of single-payer health care all across the United States, and that's a very good website, pnhp.org. As we know, the access to medical care and primary care, which is what I do, primary medical care, is terrible. And I am mad as hell that after 38 years, I have to read that the World Health Organization lists the United States as 37th in the world in health outcomes.
I'm mad as hell because I trained for 11 years after graduating from high school to be able to provide primary care internal medicine. That's how long it takes to train to be an internist. The heart and soul of primary care is relationships with people. It's being able to provide comprehensive, holistic, continuous care. And it's really become almost impossible to do that in this country. Primary care physicians have been reduced to gatekeepers. How many of you feel that you get enough time with your primary care physician when you go in for a checkup or when you go in for an office visit? And we hate it as much as you hate it. A lower percentage of your healthcare dollars actually go for care.
Hospitals are almost forced to buy very expensive equipment and then use that very expensive equipment and charge very high prices for results that we aren't sure are much better than before they bought all that expensive equipment. We need to put the public back in control so we have a system that will take care of people to prevent these tragedies that we see in our cancer center. And that's why I'm mad as hell.
I'm an emergency physician for almost just shy of 3 decades. And I'm mad about all this stuff, but what I'm really mad about is not health care. We have a healthcare non-system that's made up of a lot of economic entities. Clinics, doctors, hospitals, pharmacies, drug companies, insurance companies, medical supply companies, and a whole lot of lawyers. What they're all trying to do is maximize profits. Because of the perverse incentives in the system, We've got people that are getting too much care. They're on too many medications, they've got too many doctors, we're running out of primary care doctors because the specialists get paid more. We have people suffering because they're having too many interventions on too many medications, at great expense to all of us. 60% of all of the money in this healthcare non-system is already your money, taxpayer money. On the other end of the spectrum, we have people that aren't getting the care that they need when they need it. These people are suffering and they're getting sicker, and then they come to my emergency room, and when they end up in the ICU, it's costing all of you more. Our political process is being hijacked by the industry once again to manipulate public policy for profits instead of public good.